If you are preparing for a VBAC, I have put together a free guide to help you in your preparation. It's called Preparing for a VBAC, your first three steps to an empowered birth experience. This guide will walk you through the first three steps that you need to make on your VBAC preparation journey, and it'll make the whole process a lot easier and more straightforward for you. So if you want to grab that guide, go to thehannahgill.com/first steps. Again, that is thehannahgill.com/first steps. Hey there, welcome back to Motherhood Flow. Today, our topic of discussion is going to be naturopathic medicine, hormones, menopause, all that fun stuff. And our guest is Dr. Robyn Wright. Dr. Wright has over 20 years of healthcare experience from answering phones to being a doctor. After earning her undergraduate degree at LaSalle University, she managed a series of weight loss centers and even started her own health coaching business before entering medical school. In 2018, she earned a medical degree from the Southwest College of Naturopathic Medicine, and upon graduation, she completed a year-long residency in primary care. Her goal is to equip you with the knowledge to take control of your health, address the root causes of your concerns, and guide you towards achieving sustainable, transformative results. Dr. Wright focuses her practice on hormone, thyroid, and metabolic health and is located on the south side of Indianapolis, offering in-person or telehealth appointments. I have been working with Dr. Wright, and I'm very excited to see my results from working with her to work on my hormones and my gut health and everything that comes with overall health and wellness. So please welcome Dr. Wright to the show. I'm your host, Hannah Gill, and this is Motherhood Flow. All right. Hi, Robyn. Welcome to the show. Thank you so much for being here.
Thanks for having me.
If you could just go give a brief introduction and background about who you are, what you do, and how you got into what you do today.
Sure. Yeah. I mean, it's kind of a little windy road how I got here, but I graduated from high school and I played Division I volleyball at LaSalle University in Philadelphia. And there I got a biology and psychology degree. And I worked in a variety of different healthcare capacities. I kind of started answering phones and did a lot of worked in physical therapy offices, different types of healthcare facilities, mainly on my breaks from college. So I've always wanted to do something in healthcare. And then after graduation, I ended up going to PA school in Fort Wayne, but I didn't know about naturopathic medicine at that point in time. So to me, it was like I started to do the rotations, and something's missing here. I feel like I'm just walking in and having a 2-minute conversation with a patient and either refilling a med, starting a new med, increasing a dose, and kind of like, see you in a couple months or see you in a year kind of thing. It just didn't really mesh. Something wasn't there. So I went through and I ended up working in pharmaceutical sales. And from there, I realized that side of healthcare and then moved into really managing weight loss centers. And that's where I discovered naturopathic medicine. So one of the girls that I had worked with graduated from Bastyr University. So that piqued my interest. And I was like, what's naturopathic medicine? So I kind of kicked the can down the road a little bit. I was like, I don't know. That's a big investment, 4 years, medical school. So I ended up getting my health coaching certificate from Institute for Integrative Nutrition. And I had my business doing health coaching for years and before I went to medical school. But what ended up happening too is I kind of got to the point where legally I could not make the recommendations that I knew. So like my last contract I had was with a recovery center in Florida where I was developing amino acid formulations to heal the neurotransmitter receptors in the body, heal the gut as well. So I had a whole a nutritional program and IV therapy program, but I had to have everybody else sign off on it because I didn't have the credentials. So eventually I just said, you know what, it's time. So I went to medical school and I graduated and we did a year in residency. So I've been practicing now coming up on, was it 6.5, 7 years? Yep, I did a year of primary care residency. So down in Arizona, my scope is very broad and I can do pretty much anything. I have a DEA license, I have NPI number, I can order imaging, I can do INDs, sutures, wellbone exams. I can do all of it down there. Here it's a little different, but we're working on it.
And how often are you in Arizona compared to Indiana?
I maintain my practice down there. So I go down about every 8 to 12 weeks,
Okay.
and I'll spend a week or two down there. Just because a lot of the stuff there I have to be in person, but
Hmm.
I maintain telehealth. So if people need labs or a lab review, or if there's an acute visit or something, I can see them telehealth. But when I go down there, I do a lot of IV therapies and
Hmm.
ozone.
Okay.
So if you're familiar with major autologous hemotherapy, it's basically, I'm drawing blood, put it in with a saline, and then rock that back and forth with some ozone and infuse that right back in. It's great for inflammation. It kills virus, bacteria, mold, yeast, fungus, all the things.
Okay.
So there's a lot of different therapies that I do there that I need to be there. I also do regenerative joint injections. So if you've ever
Hmm.
heard of PRP and prolotherapy,
Hmm.
I do those. So I have to kind of be there to inject the shoulder joint, knee joint, that kind of stuff.
Right.
So I go down about every 8 to 12 weeks.
Okay. So, what would you say out of everything that you do are you the most passionate about and that you like to focus on the most if possible?
I really enjoy hormones and the
Hmm.
endocrine system in general. To me, it's kind of like the what do I say? I almost feel like it's like a Sherlock Holmes deal for me. Like I'm almost like a private investigator because I'm going to go and look at all the labs and figure out, okay, is it the adrenals? Is it thyroid? Is it, ovarian hormones? And, they all play together. So you have to look at all of it, which I kind of like. And then eventually you end up getting into the gut because that also will obviously impact everything. So I
Yeah.
feel like for me, I've kind of fallen into, I used to treat pretty much everything, and I still do, but I really enjoy endocrine, hormones, that kind of stuff.
Mhm. So, do you focus on a certain life stage or just all life stages? Are you focusing mostly on women, men, a mixture of everything?
Right. Yep. I treat both men and women, but I tend to see more women. I
Hmm.
feel like obviously our hormones are a little more complicated, and whether it's good or bad, women are usually a little more in tune with their body.
Hmm.
And if something's a little off, they're willing to seek help faster. Where a lot of men kind of wait till the wheels are falling off, and then they're like, "Oh, okay,
Yeah.
I need to go. I need to go get this fixed tomorrow. Like it needs to be done now." That kind of thing. So
Mhm.
I do treat men and women both, and yeah, it depends on stage of life. I mean, I work with fertility. I work with teens as well. If they're having irregular cycles, things like PCOS, endometriosis, infertility on both sides, I could work with that. And then I do end up seeing a lot with perimenopause and menopause as well, because that gets a little wonky. Usually about age 35, our hormones start to, do little shifts here and there. And then, we move into that perimenopausal stage where it can really last a decade plus.
Mhm.
So that's the thing. A lot of people they don't need to suffer. There's no reason that you can't move through perimenopause and menopause with some resilience and some grace too. So that's, yeah, usually what I end up doing the most of.
Yeah, and my a lot of my listeners are either currently having babies and they're in their late 20s, early 30s, even earlier 20s sometimes, but or they're done having babies, moving into that stage of motherhood. But as
Yeah.
someone who is turned 30 last year and hearing that like perimenopause can start in the 30s, it's been more on my radar and watching my mom, she's in the thick of menopause right now, and just watching
Yeah.
that, it's something that I've never really looked into because I've never been in that stage. But now that I'm physically seeing my mom go through it and getting to the age where it could be creeping up slowly, it's more on my radar now. So it's more about something I'm wanting to learn about, and I'm sure a lot of my listeners will want to learn about too. So you said perimenopause
Mm-hmm.
can start in the 30s. What are like
Yep.
some symptoms that would show that this is potentially perimenopause starting?
Well, usually you'll notice some cycle irregularities. Maybe the cycle length will change. So you might normally bleed, every, 25, 28, whatever days. And then all of a sudden, maybe it's a little more frequent. That can be a sign. Or it may not be every month. It may just be like, well, this month, that's kind of weird. It's a little off. And then you're back to your regular. So that can be kind of be a clue there. progesterone is the first hormone that starts to decrease with perimenopause. And so a lot of times women will notice their cycles are heavier, a little more clotty. And that could be a thing. The other thing is sleep disturbance. So progesterone is very calming. It's a calming neurosteroid. So some women may have issues falling or staying asleep. That could be a sign or a symptom that there's something going on there. And the other thing is like anxiousness is another thing that patients will express. They're like, I just feel more on edge, or before I might be able to let something kind of roll off my shoulders and it's like not a big deal. But now it's like, it's more like, whoa, like what, you can't really let it roll off the shoulders anymore. It's more of that underlying anxiousness. So those are some of the bigger ones that I'd say people notice that report and that I see clinically.
So is there anything that actually needs to be done for the perimenopause stage? Or is it just like things you can do to help for when you're actually going through menopause? Like, there anything that we need to be doing proactively to kind of help ease the transition?
Sure. So I always have my patients make sure they're cleaning up their lifestyle, right? So you're always thinking of making sure we're eating enough food. I think sometimes as women, we don't eat enough. We're too busy taking care of everybody else, and we're just like grab and go kind of stuff. But you actually have to have enough calories to make hormones. You have to have enough fat to make hormones. So you're making sure you got your lifestyle stuff. Like we're drinking water, we're reducing some alcohol. I mean, don't shoot the messenger, but it's not the best thing for hormones. But yeah, so those things, the lifestyle stuff, and then moving the body is really, really helpful. So as we age, we start to lose muscle mass, and that is not good for aging or for hormones as well. So usually I start to recommend doing some sort of weight training. It doesn't have to be, you're getting your PRs and busting it out in the gym every day, but something like even some body weight stuff, working with a personal trainer, HIIT type workouts, those can be beneficial. It just depends on where that person is starting. But definitely those few things. And in the diet realm, I'm usually having patients start to increase their protein consumption as they are aging, because again, we are losing muscle mass as we age, and those protein requirements actually go up. So I usually recommend for most of my patients at least 20 to 30 grams per meal. And that's a good, recommendation for most everyone. Now, of course, there's some medical conditions where high protein and all of that, but like as a general type, you want to shoot for that. And then, if you're going to work out, we want to build in some more protein too. So I would say, the protein, getting the lifestyle factors, cutting some of those sugars out, getting the alcohol on, moderation, and then movement. We got to move the body and then get some weight training on there.
And how would these processes like perimenopause, menopause, and all of this be affected if someone was on hormonal birth control or something similar to a hormonal birth control, a medication that would affect hormones and natural cycles? Like, how is that? Is that going to delay the process? Is it going to make it come faster? Is your body going to react differently?
Right. So it depends on the type of birth control that you're using. If you're using hormonal, I mean, obviously that is pretty much going to suppress ovulation, and it kind of puts you in like a fake menopause. So you're not actually having a real bleed. It's a chemical bleed, which is not really helpful for the body. Having a full cycle ovulating is very important. So when you're constantly taking those, and there are some OBs that will just tell women, like, okay, you're starting to have changes where we could run your hormones, but we already know they're going to be low or off. And we're really not going to do anything until, menopause, if they do anything at all. So why don't we just put you on birth control to manage that? And that way, by the time, 10, 15 years goes by, you pull that birth control and really those hormones are super low. So sometimes they'll do that. I find that, I had a patient who was on birth control for regular type cycles, but she was having hormonal symptoms of menopause. Well, this woman was 21. She was 19, 21. All that to say, so she was having hot flashes, vaginal dryness, like all the symptoms of full blown menopause in her 20s. And that was what her OB was like, well, yep, that's kind of what we got. So
Mhm.
let her go. And then she came to see me, which we ended up working together. We got off of the birth control in order to help her hormones get naturally balanced, and move that way. Now, IUDs, of course, you can get copper ID. That's a non-hormonal option. Some of those, some women still cycle with them. Some, they don't. It just kind of depends. But you're also looking at, again, those symptoms. Just because you're taking the birth control doesn't mean all of those hormonal symptoms are going to go away. So you really have to work with the patient and figure out where they are in that thought process too. Like, do you still want to have kids? Because if we still want to have kids, then we're going to have to put something else in place for pregnancy prevention, right? If we're not going to stay on that hormonal birth control. But usually what happens is that the hormonal birth control is just kind of a band-aid. It's masking whatever hormonal dysregulation is going on naturally with you.
Mhm.
So as soon as you pull that off, all of that still exists. That's not fixed. That's just, it's kind of just, okay, we took the Band-Aid off and we just see how that goes. And that's where, I come in. I can really help to treat that and to manage the hormones and the fluctuation with everything as you're coming off of the pill, and find, some herbs, some supplements, some things that can help that transition. Because a
Mhm.
lot of women will have pretty significant, like rebound effects. So once you pull that birth control, I mean, the first few months can be a kind of a up and down roller coaster there, while their body is trying to regulate everything on their own again for the first time, and sometimes for decades.
Mhm. So, how would someone know when they're going from perimenopause to full blown menopause? Like, and you said there's a range there of when it could happen, but how would you know, like, okay,
Yeah.
this is the shift?
Well, technically, a whole year without a period is the definition of true menopause. So once you go an entire year without a cycle, that is menopause. Then you're officially in menopause. But you can have, I've had some women that come in and, they go 9, 10 months with no cycle, and then boom, all of a sudden they have a cycle, still not fully in menopause. That's still perimenopause. The lab work, what we're looking at our FSH and LH, which follicle stimulating hormone and luteinizing hormone. Those are your ovarian hormones. So as we get closer to menopause, those levels are going to continually increase. So when I'm looking at that lab, typically for someone who is fertile, they're still wanting to have kids, that kind of phase of life. I mean, those FSH, LH levels are usually ideally like 3 to 4-ish and in a 1-to-1 ratio. But as we get closer to perimenopause and in menopause, you're going to see those numbers go up and up and up into the teens, and then we're up into the 20s. And once we're there, that just means that the ovaries and the brain, they're not really communicating anymore because, they're done. We're done. The party's over. We're not ovulating anymore. But I will say it is interesting because a lot of times as your ovaries are kind of like shutting down, you may ovulate more than once in a cycle. It's kind of like your body's like, all right, this is it. This is the last chance. So you might spit out a couple eggs in an ovulation cycle, or you may not ovulate, but it's kind of like the grand finale. It's like let's get it all out. So I always caution people, be careful, because you can still, unless you're not ovulating, and those are things we can tell with labs and symptoms, but a lot of times that'll change. You may have 4 or 5 cycles where you're not ovulating, and then you might have that one cycle that you do, and it's not just one egg that comes out. So I've had a couple patients where, that's kind of, they're like 45, 46, and they're now in menopause. They come to me and say, well, yeah, I got pregnant at 46 because I thought I didn't think I was ovulating.
Right. And then they could get pregnant with twins.
Mm-hmm. Well, yeah, and that's the other thing that actually increases because of this, like the body spits out those more eggs. So
Gotcha.
yeah,
That
that,
makes
that
sense.
does happen a little bit more frequently. The increased chance for twins to be conceived. Yeah, I don't know. I mean, I'm 42, so I got to tell you, if it were me at 42 and I was like twins, whoo,
That's a lot.
it'd be a doozy. But yeah. Mm-hmm.
So
So
what
usually those are the kind of the symptoms and the signs, and then lab work wise, kind of we're looking at. And again, like the hormones, estrogen, progesterone, testosterone, those are all going to start to go down, and then eventually with menopause, they're basically non-existent. So when I have those things, like sure, maybe we're full blown menopause, no cycle for a full year. All of those hormones are hormonal, where they should be for that age range and phase of life. But I'm also looking at hormones not just in the symptom management, but the importance in the body. So, for cardiovascular health, for bone health, for brain health, it's not just about, yeah, my cycles are yucky and crampy and terrible, or I'm in menopause and all of that's done, but you still have to monitor your hormones for optimal levels, not just for the symptoms, but for your body. I mean, estrogen and testosterone play a huge role in your bone health, in your cardiovascular health, and in your brain health too. So, same thing, progesterone. So those ones, I always remind people, it's not just about the symptom management. It also is important for aging and for your body and risk factors for certain things.
so like you said about the symptom management is one thing and then the
Mm-hmm.
overall health. I've heard so many women, including my mother, say like menopause is awful and the symptoms are horrible and it's just awful the whole time. Is there anything, is that just how it's meant to be? Is there anything you can do to kind of make it a more experience that's not so hard to go through? I know it's gonna affect everyone differently, but is there anything to kind of ease
Sure.
the symptoms?
Yeah, everybody's a little different in how they respond to different things, but I'm a big fan of supporting with herbs or depending on what else is going on with the individual. Like sometimes I have patients that come in and they have estrogen or progesterone positive breast cancers. So, those people, even though the research does not, well, the research is kind of old when you think about bioidentical hormone replacement versus HRT, just regular hormone replacement therapy. A lot of those studies were done, a long time ago for HRT, and that was all based off of synthetics. I prescribe bioidenticals and I use herbs to help with that. And the safety profile of bioidenticals is much better than your regular synthetic type estrogens and progestins that you may get from somebody else there. But yeah, there's things you can do. So a couple of the herbs that I like is maca. Maca is a really nice herb that you can use. And I like a product that has the different strains of maca for different phases of life. So if you're still cycling, there's a strain of maca for that. There's a strain of maca if you're perimenopause. There's a strain of maca if you are in menopause. So I like to utilize those. And then I also like Vitex. Vitex is a great herb that can help support all the hormones, but even progesterone as well. And then there's a plethora of different herbs to use for testosterone. So, and we're really just seeing how the individual responds to that. And the individuals that maybe do have a higher risk, like a estrogen positive, progesterone positive type cancers, then we can do things with homeopathy. So if you're familiar with that at all, those are the little white pellets that dissolve under the tongue. So, and there's uh, tons of different remedies that we could work with to see what would, depends how that patient presents. So, like if their hot flashes are starting in the stomach and going up, do they start in the head and do you sweat? Like, do they start in the back and travel up? Like, all of these are different things that would differentiate different homeopathic remedies. So, that's usually where I start with that. And sometimes, their symptoms are so bad, they can't, there's the quality of life as well. So they may choose to do more of a bioidentical replacement to get some symptom management and some better quality of life, and then eventually being able to move just to herbs, right? So that really, it's me and the patient just talking through that and like, where do you feel most comfortable now? What are your goals right now? Where do you want to end that? Do you want to end with the herbs? Are you okay staying on the bioidenticals? Like, that's usually a ongoing conversation that we're having.
Okay. And then at what point is menopause considered to be done? Like these symptoms go away and that you're out of that stage, or is menopause just forever after from that point on?
Yeah. So, I mean, when you'll be considered postmenopausal, really, after you complete everything, you have no cycle, then you're considered postmenopausal. So, that, I guess, definition goes forever. You're
Hmm.
postmenopausal at that point. The symptoms will go away eventually.
Hmm.
Most women will have the hot flashes go away. That will happen over time. And that, again, that could be years, months. It just depends on the person. But yeah,
Okay.
you would be considered postmenopausal at
Okay.
that point, and that carries through.
Okay. So if someone were to come to you, like say, I know we're talking about menopause, but say like me, I'm a 30-year-old. I'm I'm still having children, but say I'm showing signs of perimenopause, but I still want to have children. I'm not done having kids, but I'm showing these signs, maybe
Uh-huh.
getting closer to that stage. Is there anything you can do to help the fertility while you're kind of showing symptoms of that?
For sure. So we always want to test, don't guess. So I'm definitely going to run labs to see where we're at with the hormones to make sure, like, are we ovulating? What do the hormones look like currently at this phase? And there are some supplements that are helpful, like N-acetylcysteine can help egg quality. Like, there's some things that you can put on board to help. And then what I see a lot is the progesterone. So progesterone is usually one that we really have to work to address, especially if we're I guess in OB land, like, geriatric pregnancy age, which I was 37 when I had my son. So yeah, it was the geriatric pregnancy. All that to say, when you're thinking of, so you got the NAC that can help, but the progesterone is super important because that's one of the first hormones that goes down. And progesterone you have to have because that's what's responsible for allowing the fertilization, keeping that all viable as we're traveling for implantation to happen. So that first trimester, progesterone production to keep that pregnancy viable comes from you. And then that second trimester is when the placenta takes over and starts to produce hormones to, carry the pregnancy through. So a lot of times what I see in that age group, the 30s, 40s, in there is we're going to have to put some progesterone on board because they're just not making enough of their own. You may have enough to get a positive pregnancy test, but you may have recurring early pregnancy loss, or usually within that first trimester, if you have miscarriage there, a lot of times it's that luteal phase defect, which is that low progesterone, where we need to put that on board to help keep the pregnancy viable into the second trimester to make until the placenta starts to take that over. So usually those are the things that I'm looking at is, okay, like what can we do? And the other thing too is we want to make sure with antioxidants. So we want to put a lot of antioxidant support on board to make sure that we're keeping, the eggs and the over, like everything in the best possible scenario to have conception, right?
Okay, that makes sense because I know a lot of women who don't start having children, like you said, till later. You were 37 when you had your son, and then
Mm-hmm.
they start having these symptoms, and they're thinking that it's just going to be too hard for them to have kids, or they're not going to be able to have any more children if they already have children. So it's good to know that
Right.
they're
Yeah.
even if
And
you're
there's
showing
other
those
things
symptoms,
too
you
that
can
we
have
can
that.
do.
Yeah, yeah.
For sure. And there's things you can do, again, depending on labs. Like when I run the FSH, LH of the ovarian hormones, if that LH level is high, pretty high, I mean, that's hard for you to ovulate. And then we need to make sure we bring that down. So there's some different herbs and compounds that I would recommend to help improve that ovarian and brain communication. So it brings that LH level down so that way you ovulate and you're able to conceive. So
Hmm.
we do monitor those. And if it is somebody that comes to me and they're, having issues and maybe they are, later 30s, early 40s, in their 40s, whatever, we may run the labs a little more frequently just to see the different cycles. So usually I'll run labs for my patients at least every 6 months, but sometimes we need to do that more frequently, maybe every 3 months,
Hmm.
until we can kind of get an idea of what your cycles are looking like. And then we can hit that so we know, okay, well, this cycle, most likely you'll be here. So we'll put that support on board. Does that make sense?
Yes, it does.
Yeah.
So you had mentioned that you have multiple locations where you practice, Arizona and Indianapolis.
Mhm.
So for those people that want to work with you, what's the easiest way? So if you're local to Indianapolis, you're on the south side, but say someone wants to work with you
Mhm.
virtually, like what is the process for
Sure.
that?
Yeah, so you can just go to my website, healthyevolutions.com, and there's a book now page. You can go and just fill out the information. It sends the note to me that you like to chat, and then I'll get a hold of you. We'll find a time. We can set up a new patient appointment. I do offer a free 15-minute consult. Just some people aren't familiar with naturopathic medicine and how that is and what I can and can't do. So that way there's no confusion there. And to also make sure it's a case that I'm okay with, because as much as I like to say I know everything, I don't. So I want to make sure it's a case that I feel confident that I could contribute and help the patient. But yeah, so you would go website, fill that out. That's the easiest way to do it. You could always call me, and that's the number there. I'm sure you'll put up for everybody to get, but it's
Yeah.
480-442-2261. And we'll set a time from there. And the first appointment is an hour long. So in naturopathic medicine, like you're not doing a 10-minute new patient appointment, like it's an
Mhm.
hour long. So we're going through a very extensive intake. There's a lot of questions on the intake. People are like, oh my gosh, it took me a while to fill it out. It's like thought provoking. Like, I don't know, like, did I grow up on a farm with a lot of pesticide use? Maybe, I don't know. It's that kind of stuff we're looking at
Right.
too, because that can help us know, like, okay, what pathways do we need to focus on? What is the priority?
Mhm.
So we would do that, spend that hour together. And at the end of the visit, usually we're starting with some kind of treatment. And then I usually will order labs. So whatever labs may be indicated, whether it's just general blood work or maybe it's more specialty type testing, like a food sensitivity panel or a very intensive stool analysis that I do. So anyway, so we kind of get that all put together, and then I have patients come back 2 weeks after
Mhm.
that to review those results and really fine tune the plan.
And obviously it's going to depend on the patient, but how long of a lifespan, like is someone like how long is someone going to expect to be working with you for the most part? Like is someone come in and
Mhm.
they may have their issues resolved in 3 months, or is it going to be a few years, or what's the general lifespan for that?
Yeah, that's a hard one to answer. I would say most people, again, it's also on that's a hard one to answer just because
Yeah.
there's so many variables to go into it. But I'd say most people within 6 months or so, they've got significant improvement. Like
Hmm.
I just had a patient come in, and it's a male, and he had been, let's see, we've only been working together 8 weeks, and I just did a follow up, and he's already about 25 to 50% better depending
Hmm.
on the day. So
Yeah.
it just depends. And then I have
And
others where I have a really tough PCOS case right now that we have been, doing this and doing that. And she's much better, but we still haven't quite nailed it. And we've been working together for a year. So
hmm
she's better, but it's not, where we want it to be. So
hmm
it just depends. A lot of these you have to realize it's not a one and done for sure. It's
right.
not like, oh, you just see me once, we get some supplements and that's it. Like it is a process, and you got to remember how naturopathic doctors focus. They focus on the whole body and
Hmm.
healing from inside out and figuring out the root cause. So depending on how complicated that case is, I mean, that can take a little while for the person to get the answer, to get the healing they need.
Hmm.
So I'd say, yeah, usually within 6 months or so, most people are improved or 100% better. I mean, you're in that kind of realm. But yeah, some of those take a while. It just depends.
And do people, is it like, so like your primary care doctor, you go back every year for an annual checkup? Do most patients
For
stay with
sure.
you
Yeah,
like
I always
coming that?
recommend
Okay.
that. Once we get things dialed in and things are cooking and we're all set, I always do yearly lab work. And if,
Hmm.
if I am prescribing medications for people like thyroid, I don't just do that once a year. I do check. I require that at least every 6 months,
Yeah.
especially if I'm in like testosterone, it's a controlled substance. So I'm always monitoring that every 3 to 6 months for people if
Hmm.
I'm prescribing. So yeah, but at least yearly for sure. I mean, I
Hmm.
am a big proponent of the testing, not guessing. Like it's important to know your
Yeah.
numbers, and that there is no way to really do that without testing. I mean,
Yeah.
I'm sure you can do the symptoms and, subjective, objective type measurements, but yeah, getting everything at least yearly, definitely.
Yeah. Yeah, I just wanted to kind of go into that because like you said, a lot of people are not familiar with naturopathic medicine and they may be going
Hmm.
into it like, I don't even know what to expect from this. So
Sure.
it's good to kind of have that out there in case anyone is interested or curious, just to even learn more about it. Especially if you're in the Indy area or virtually, you can reach out to Robyn. Is there anything else,
Yeah.
Robyn, that you wanted to discuss or highlight or talk about?
I think it's the kind of a sentiment is, you're not alone. You don't have to go through this and suffer. I know personally myself, I went into my OB. I was like, hey, can we run some hormones? Because I'm 42, I'm starting to have some symptoms of stuff and I just want to see where they were. Right. And they're like, oh, no, we don't need to run labs, and it kind of, you get dismissed a lot in a traditional type setting, which that's fine. That's how they're trained. That's how they're practicing, and that's totally fine and valid for them. But I just want people to know that you don't have to suffer. You don't have to just stick it out until, you're 58 or 65 or however old before all these hormone things just, go. I'm here to help. We can help. There's things to do.
Well, awesome. Thank you so much, Robyn. And like she mentioned, I will put all the links and numbers and everything to contact Robyn in the show notes for you. Again, she's on the south side if you're in the Indianapolis area. She says she's also, what part of
Yeah.
Arizona are you in?
Scottsdale.
Scottsdale. Okay. So if you're in either of those
Yep.
areas or if you need help virtually, reach out to Robyn and she will be happy to help. All right. Well, thank you so much, Robyn, for being here.
Yeah. Thanks for having me. This has been so great.
You just finished another episode of Motherhood Flow. For more, head over to thehannahgill.com or on Instagram @thehannahgill. As a reminder, this podcast is provided to you for educational and entertainment purposes only. It should not be considered a substitute for medical advice. Until next time, keep flowing.